Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. Before we get into today's episode, I wanted to remind listeners to check out the second annual You're a Health Policy Wonk If contest submissions and winner that was revealed earlier this month on Health Affairs Forefront. Also, this week, we released an article ahead of print of our August issue. The article is by Thomas Selden and colleagues, and the article is titled Adverse Childhood Experiences, Healthcare Utilization, and Expenditures in Adulthood. Check it out on healthaffairs.org. And we are still taking submissions for abstracts for our upcoming food, nutrition, and health theme issue, but the deadline is nigh. Submit by end of day, July 29th. And that's not all. First off, welcome to the program, Rob Lott.
Hey, Jeff. Good to be here.
Yeah, and we also had another RFA announced, correct?
Yeah, that's right. We have an upcoming Forefront series on supplemental benefits in Medicare Advantage. And so we were excited to put out a call for submissions for articles on that topic, which folks can submit as soon as they're ready. We'll accept those on a rolling basis.
Thanks, Rob, for that information. Now let's get into the program. Rob, what do you think about the new Les Savvy 5 record?
I haven't heard it yet, Jeff.
Oh man, yeah, two middle-aged men with beards talking about music from their youth. All right, but that's not what we're here to talk about. Check out the album, I guess. We are going to talk about medical debt proposals today. I know probably the biggest news is President Joe Biden removing himself from the upcoming presidential election. We may cover something along those lines with the presidential election in a future episode, but not today. Today, we are going to talk about how the Biden administration last month announced a proposal to prohibit medical bills from being included on credit reports. This has been a decent time coming. Rob, can you share details of this proposal with us?
Yeah, sure, Jeff. So as you say, this has been a long time coming. This is not the Biden administration's first action on this issue. If you go back to 2020, there were 46 million Americans who had some kind of medical debt on their credit reports. So a pretty big issue for a lot of Americans. And then if we go to 2022, that's when the White House told all of its agencies to disregard medical debt when underwriting its various loan programs. So the USDA, for example, offers rural housing loans, and they were told to stop considering medical debt of potential borrowers when they were assessing their credit risk. Same with the VA and small business loan programs. And then around that same time, the three major credit agencies removed medical debt under $500 from consumers' credit reports, as well as those debts that were less than a year past due. So kind of a big deal. And that had the consequence of raising some people's credit ratings and reducing the number of people with medical debt on their credit reports. And then so that brings us to the announcement you pointed to, Jeff. Last September, the administration sort of teased the idea of a new rule. It was sort of like a save the date before a wedding. They were basically saying, okay, this is our plan. We've got a lot of work to do to roll it out. And they finally did 9 months later this summer with a proposed rule to ban credit reporting agencies from incorporating medical debt when calculating credit scores. They will also bar lenders from using medical debt to decide who's eligible for loans. So basically, your medical debt can't count against you.
Okay, great. Thanks for that. And yeah, as we as a healthcare community talk about the social determinants, social drivers of health, they're basically trends that can affect a person's health. And one of the big ones is economic outlook, how much income a person has, what sort of forces can act to affect the financial health of a person. So credit scores, seemingly medical bills, big deal. What impact would this likely have on the American public?
You know, it's a pretty big deal. People in the United States owe at least $220 billion in medical debt. More than 3 million people owe medical debt of more than $10,000. And so this rule, of course, is not going to make the debt go away. And it doesn't solve the systemic problems that have led to so many people having this debt on their plates or on their shoulders, really. And the fact that the debt disproportionately affects people of color and people with disabilities and other vulnerable communities. But it does address this sort of one pernicious element of the system, which is that so many of the keys to mobility in our society, whether it's getting a home or having a car to get to your job, all these things depend on having good credit. And there's so many stories of people being struck by one major health crisis and all the bills associated with that crisis that they can't pay. And then suddenly it's a black mark on their credit report, which in turn makes it so much harder to climb out of this hole. And certainly things like not having a car or losing your home, those are pretty bad for your health too. And it becomes a really vicious cycle. And so what this rule does, it kind of tries to kind of break one of the links in that chain. It sort of tries to break the cycle. And so we've seen the effects already, actually. Like I said earlier, about 46 million people in 2020 with medical debt on their credit report. Now it's just 15 million, thanks to some of those changes I mentioned earlier. And then if this rule takes effect, it will be zero. And, the administration says that if that happens, it's going to have the average effect of raising those 15 million people's credit ratings by about 20 points and to the approval of over 20,000 additional mortgages every year. And those are, in theory, more homes, more cars, the kinds of investments that are really fundamental to upward mobility.
You don't need to put yourself on blast, but do you know your credit score off the top of your head?
I don't. I probably should, but
I can't remember it either. But do you really? What it reminded me of? You reminded me of a story of a friend who got one of their credit reports and got one of the reasons back, and he got dinged because of an unpaid pizza delivery at one point many years ago. And I might be getting the details wrong, but it just reminded me of that for some reason. So it can be small. I mean, your credit can get dinged for something really small, such as a pizza delivery.
Yeah, it's a little bit of a black box. I mean, and I'm sort of illustrating it by saying I have no idea what my credit score is. Obviously, I'm, fortunate enough to not have to worry about it in that respect. But it does go to show that, like, there are some major question marks in how people understand their own credit score and what they can do if they're sort of dinged with a bad mark.
So going back to the actual proposed policy. So as we noted, it is a proposal. Likely there'll be some rulemaking, but there's probably going to be comments involved from lobbyists and things of that nature. So what is the likelihood that this proposed policy will be just copy and pasted to a final rule?
So we're already in sort of the rulemaking process right now. The Consumer Financial Protection Bureau is taking comments through August 12th. So listeners, if you were thinking about putting in a comment, get to work. You've got a few weeks left to put your comments in there. And then the administration is saying they're aiming to finalize this in late 2024 or early 2025. And pop quiz, Jeff, can you think of any major event set to take place between now and then?
No, I plan on being asleep all of November.
Okay, very good. Maybe Lollapalooza,
Yeah, right.
The Paris Olympics, and the election. So obviously, I think if the Democratic candidate for president is elected, we can be pretty confident that this rule will go through pretty close to what it's looking like right now. If President Trump, or I should say, if Donald Trump is elected president, it's a little bit of a question mark. Certainly during his 4 years as president, he did nothing on medical debt as an issue. And so not a huge priority. Whether or not the rule sort of scoots by and takes place and takes effect anyway, that's possible. There's not a huge amount of resistance to this rule from sort of advocates and stakeholders out there. Certainly folks in the collections industry have expressed resistance, and there are some people that feel if these kinds of debts aren't placed on credit reports, then some people might be less willing to pay their medical bills. That's sort of the argument. What they're not saying is that actually it's a very low percentage of people who pay off their medical debts anyway. And so it's unlikely to have a major impact on sort of the budgetary bottom line of hospitals and health systems and stuff like that.
And my apologies, Rob. I know you're out there in Chicago, home of the Improv. I felt like I was just a bad scene partner with you. Like really shut it down. I didn't do yes and.
No worries.
My apologies. But yeah, as we wrap up, does Health Affairs have any interesting research on medical debt worth calling out?
Yeah, well, Jeff, let me take a quick pause and ask if you remember The Sun Also Rises.
Yes, I do.
Classic American novel by Ernest Hemingway. So there's a line, it's off quoted actually. There's a character who went bankrupt, Mike Campbell, and someone asked him, "How did you go bankrupt?" And he said, 2 ways, gradually and then suddenly. And I feel a little bit like the progress on this issue has also happened gradually and then suddenly. And so, although there's been all this action in the last 2, 3, 4 years around medical debt, it's actually been a subject of research for quite a while. And I'm going to point readers, our Health Affairs super fans, to actually a pair of articles from 2005 and 2006. One was written by Steffi Woolhandler, David Himmelstein, Deborah Thorne, and a little-known Harvard professor, Elizabeth Warren, where they examined the contributions of illness and injury to bankruptcy. And then guess what? We had a response to that piece published a few months later by David Dranoff and Michael Millinson. David Dranoff and Michael Millinson sort of taking issue with some of their methods and asking about kind of the causal relationship between their findings. There was some disagreement over whether or not they were addressing the solidly middle-class population versus the marginally middle-class population. I'm not going to get into all the details other than to encourage our readers to check it out. It's kind of a wonderful snapshot from almost 20 years. And of course, in the intervening time, we've published a number of policy briefs and other really interesting stuff that, without taking too much credit, I think sort of laid the foundation for policymakers to see this as a priority.
Yeah, well, thanks for calling out those articles from 20 years ago. If what the New York media is telling me is correct, that time era is making a comeback.
That's right. So check it out, and it's I don't know. I was going to make a reference to the pop music of the 2005s, and I can't even think of who that was.
Yeah, you can.
Is that the Strokes?
Put on some Strokes and call it a day there. Well, Rob, thanks again for joining us on Health Affairs this week. Listener, please share this episode with a friend. Whether or not you know their credit report, it might help them out. Thanks, and please subscribe wherever you listen to your podcasts. Thanks again.
Thanks, Jeff.